My name is Dale Miron and I live in Mississauga with my husband and 2 young adult children. I have been volunteering for Kidney Cancer Canada as the membership director since February 2007. I am also a patient. In May 2004, an ultrasound revealed an 8.5 centimeter tumor on my left kidney. While waiting for my appointment with my urologist at my local hospital, I decided I needed to find out as much as I could about kidney cancer. So I went to the internet and started Googling kidney cancer. Unfortunately, back at that time, there was no Kidney Cancer Canada, so I had no one to talk to or turn to ask questions. And I felt so isolated and alone that the fear and anxiety were paramount. So I ended up spending hours and days upon days, at least 3 days solid, just searching the internet for treatment options for people with kidney cancer. Fortunately, I found a clinical trial site, and when I went on, I Googled kidney cancer and found a clinical trial that was being offered at Princess Margaret Hospital in Toronto. So I decided that this might be the best treatment option for me. So off I went to my urologist appointment, and during that appointment I discussed this treatment option with him, and he thought I would be a great candidate. So he sent me off to Princess Margaret Hospital. I did go on the clinical trial, and for 6 fabulous years my stage 4 kidney cancer remained stable. For me, the advantages of being on a clinical trial was having access to a treatment that kept a very aggressive cancer stable for 6 years with very little side effects. The side effects that I did have were so minimal that it was a small red rash and some itchiness on the skin that went away as quickly as it came. So for me, that was a great advantage. Also, knowing that I had access to the standard approach if this clinical trial didn't work was great. And I also had comfort in knowing that I was being closely monitored by a team of kidney cancer specialists. I would recommend a clinical trial to other patients in a similar situation. There are no guarantees with any type of treatment that you go on that it's going to work. So if the clinical trial is not going to cause you any more harm, I look at it as a way of increasing my treatment options. And with more treatment options, you have a greater chance of survival. During the time leading up to the scan day, I take a positive approach to this. I tell myself that the scan is something that I need to help ensure that the cancer remains stable and the treatment that I'm currently on is working. So for me, I look at it as a positive thing, and I embrace it, and I become thankful for having access to that technology. So my advice for other patients during the waiting period is to try not to let your mind create scenarios that cause a lot of worry, fear, and anxiety. For me, when I start creating these what-if scenarios that are causing me to worry and get all anxious, I try to do a number of different things. And one of them is I will connect with family, friends, fellow patients, because often talking about these fears and this anxiety helps you deal with it, and therefore you become a lot more calmer. Also, connecting with nature gives you that beautiful sense of peacefulness from inside. For me, also, I review all my treatment options because I feel having knowledge gives me empowerment, and I'm able to make decisions with my oncologist should the need arise on what my next steps are. So having this knowledge in advance, for me, also helps to relieve some of that anxiety. What I have learned about being my own best advocate through all of this is that you need to stay connected and have access to accurate and current information. Having this information allows you to ask the questions that you need to make sure that you get the best possible treatment that you can. For me, if I wasn't advocating for my own health, I don't know if I'd be sitting here. As good as the system is, many doctors are overwhelmed with the number of patients that they see and overwhelmed with the amount of information that they receive. Kidney cancer treatment options are changing all the time, and your doctor may forget to mention them, or he may even forget that this was an option. So by having information ready to advocate for yourself, in my example, having information about the clinical trial, I presented that to my urologist prior to my surgery, which then gave me the opportunity to be referred to a center of excellence where I gained access to the clinical trial, which then kept my cancer stable for 6 years. The one piece of advice I would offer a patient just beginning their journey with kidney cancer is to be an informed patient and to connect with information so that you can ask the right questions to your doctor so that you can get the best possible care available to you. Having knowledge about kidney cancer and its treatment options gives you a sense of empowerment, and this sense of empowerment gives you a feeling of control over your journey. If you are the type of person who shies away from information, then ask a friend or a family member or a relative to advocate on your behalf and to help obtain this information that is vital and very helpful to the outcome of your journey. Some of the toughest moments for me as a patient throughout my journey is when I have to make a decision on the treatment option. When one treatment is no longer effective and you have to make that decision on the next one. For me, trying to gather as much information as I can, even doing a little bit of a flow chart helps. If I go on this treatment option versus this treatment option, and then so forth and so forth, so that I get an idea of where I'm going, an idea of where I'm heading. And then taking this information and sitting down with my oncologist and discussing the pros and cons and the side effects associated with these treatment options. Then I make that decision. And then when I make that decision, I embrace it, I'm comfortable with it, and I don't turn around and look back and say, oh, I should have done this or that. So it's important to be comfortable with your decision.